All right, looks like we're on. Hello, everyone. Welcome back for another episode of Eye Health Conversations with Dr. Okogbaa. Thanks again for joining me today. So, we've been discussing this condition called dry eyes and how it can impact our everyday because we use our eyes for so many different tasks from working to entertainment, enjoying our digital devices. So this condition has really been an issue that's been growing over the last few years. And I just want everyone to be educated on how to maintain a healthy eyesight by understanding what's going on with your eyes and what are some of the things that can cause it to get dry and what you can do about it. Okay, so we discussed certain medications that can contribute to dryness. So today I am going to discuss certain medical conditions like illnesses that can actually um, contribute or further cause dry eyes or dry eye symptoms for individuals. Okay, so let's start with a very common condition, diabetes, right? We know a lot of people have diabetes. Diabetes is one of those conditions, especially when it's uncontrolled, that can actually contribute dry eyes. And basically, when you have that high glucose levels in the bloodstreams, it can impact the nerves that innervates the cornea and the reflexes of the eyes and so on. So it can all leads to decreased production of tears, the tears that are supposed to be keeping the eyes moist. So yes, so diabetes is a huge factor when it comes to experiencing dry eyes when it's not controlled. Okay. Another condition called vitamin A deficiency. Well, this is not very common, but it's one of those conditions where when lose, it causes destruction of those cells on the tear film layer that's supposed to produce mucus. And remember that the tear film has three layers, and one of those layers is a mucus layer. It's like a protective layer. It helps keep the eye moist. It keeps the tears from evaporating so quickly away from the eyes. And so, with that condition, that can also lead to severe dry eyes. Um, and so that's another one. A huge Another category of illnesses that can impact your eyes and cause it to get dry further are autoimmune or just immune disorders in general. So thyroid disease, like Graves' disease, where sometimes people can get the bulgy eyes and so on. So all of that can eventually, and it impacts the muscles around the eyes, and it can impact tear production and evaporation. And so thyroid eye disease, Graves' disease are all conditions that can cause the eye to be dry. In the same immune group, we have rheumatoid arthritis, lupus, sarcoidosis, all those um, inflammatory conditions can also lead to dry eyes, like really severe dry eyes. Another significant immune condition that can really lead to dry eyes is Sjogren's syndrome. I'm sorry, Sjogren's syndrome. That's when you have really bad dry mouth, and you can get really bad dry eyes with that as well. And so that's a condition that if you have that dry mouth symptoms, you really want to see an eye doctor to make sure that you maintain that the eyes to keep them nice and lubricated. So those are some of the illnesses or conditions that can contribute to dry eyes. Another category, and that'll be our last category we talk about, is hormonal changes, especially in women during menopause, postmenopause, and even during pregnancy can also lead to dry eyes. So if you're experiencing your eyes just more irritated, it could be these hormonal changes. They can lead to decreased production of your tears, and it can impact the tear glands and so on. And so, yes, so these are some of the conditions that can lead or participate or impact the eyes more, and basically causing the eye to be more dry. And so we talked about medications. So today we talked a little bit about certain conditions that can lead to dry eye syndrome. And so I hope you find this information, and this is all just for information for your sake of knowing. It's not medical advice, but I would recommend making sure that you get your eye examined. And if you have any signs of dry eyes, or sometimes it can be asymptomatic, but your eye doctors ask you whether or not you've been having symptoms because they see signs of dry eyes, then you really want to take that seriously and start lubricating your eyes, and talk to the doctor about what are the different things you can do to maintain the moisture in the eyes and to keep the eyes going healthy for you. Please share this video if you know anyone who would benefit from this information. And if you have not had your eyes examined, we'd be happy to see you. Call the office at 225-356-2655, or check out our website at www.lacenterforeyes.com. And we'd be happy to hear from you, and book your appointment. And I'll be happy to examine your eyes and tell you what the status of them of the eyes are, and whether or not there's any signs of dry eyes. All right. Well, thank you so much. I enjoyed this. Have a wonderful day. Bye.